Hi, everyone, and welcome to MHA621, where the content this week is an introduction to the healthcare system and to what I think you're going to find fascinating if you're not already aware of it, the concept and methodology of smart brevity. So what you can see here is the article for the week. I'd like you to focus on that. I'm going to really sort of summarize this and do a little writing and then launch into the smart brevity. One of my heroes in healthcare who has retired is Don Berwick, a pediatrician, head of the Institute for Healthcare Improvement for a number of years, and really sought to how to bring systems improvement to healthcare. Um, uh, Really an unbelievable leader. Had an opportunity to see him once speak, I think, and it was really just so impressive. Um, but earlier this year, along with some colleagues, came out with this commentary on health reform, and it's sort of interesting that this is happening at this time with federal changes that will impact healthcare throughout the country, certainly state changes as well. But I wanted to focus on the points that are made in this, not just about the notion that our healthcare system is failing, but also maybe some big picture ideas about what's necessary. So really starting almost with an optimistic view. It is very easy, if you've worked in healthcare, if you've experienced healthcare, to be on the downside, to be pessimistic. Um, it's natural as well. But certainly, at least my sense is that if you work in healthcare in any capacity, in a clinical capacity, an administrative, maybe a mix of both, you do see the underbelly of the beast. You see people and processes that might be discouraging, and it's overwhelming in a lot of ways. And yet, um, as the first line in the abstract says, it's almost this, two sides of a coin. Healthcare in the United States is the most technologically advanced, but it's also largely failing to meet the needs of the nation. Um, I'd like you to focus on this article, but I want to, and read the whole thing, please. What I'd like to do is start with how this team reimagines the healthcare system with this sort of as the summary. How do individuals and populations achieve better health? That should be the goal. Perhaps for some, it's stable health. Um, and there are certainly big picture systemic strategies. These principles would start on, oh, I'm sorry, on page 3 is really the crux of this. And I'd like to just to summarize this. The first principle is that Americans should have access to affordable, comprehensive healthcare coverage and care. Big picture. One of the themes in this course is access, but you cannot take that away from quality and cost. Um, but the key word here, there are keywords: affordable, which is the cost, comprehensive throughout one's life, um, coverage, and care. And so there's a lot of propositions in here, but I think starting with that, that is inarguably a bipartisan issue. It has nothing to do with gender or race or ethnicity. And yet it is challenging for a lot of the other reasons that we'll talk about. Second principle is stuff needs to be anchored in primary care. It needs to be the anchor. Now that primary care is expansive. It means oral care and eye checkup, and it certainly changes over one's lifetime, but that is the crux of it. The final project in this class will be a redesign of a provider office. And for many of you, the teams, you will decide on a primary care office or a dental office or an optometry clinic. It is the thing that works well better in other healthcare systems for sure. The third principle is having to do with looking at incentivization through population-based payment. Populations, instead of looking at us as 350 million individuals, look at a population. That could be a community that you are part of by birth. It could be a community where your zip code or region is. The needs are certainly different as well. The fourth principle really has to do with a topic that I think many of you have heard of, social determinants of health, and how that and this notion of equity should be prioritized. Now, social determinants of health, where you live, how much income you bring in, um, do you have access to grocery stores? Forget about the healthcare system. Those things impact our health in ways that far beyond the quality of the healthcare professionals. And so we will certainly touch upon that in this course. When we talk about cost, relates to the fifth principle here. Um, it's really the financing of the healthcare system. Um, and it's complicated because we have a public and a private system. We have 50 states with different models, and the states don't talk to each other sometimes. But that is key to access and affordability. The notion of transparency and professionalism um, is important, especially from a government perspective. So CMS, the Center for Medicaid and Medicaid Care and Medicaid Services, is the largest insurance company, I like to say, in the United States. Medicare is for sure, adding it to Medicaid. But there's a notion of there needs to be a transparency there. Seventh principle, looking at data and making decisions on data and building that into a culture of continuously learning is key. I think many of you work very closely with data information, and you know the volumes of that data that we have, particularly health information. For about a year and a bit, I've had an Aura Ring to help me manage and improve my sleep. The amount of data that I'm given from this wearable device is absolutely phenomenal. It's absolutely phenomenal. And now I admit I'm not exactly as a consumer educated enough with how to understand all that data, what to do with it then, how to help with that data improve my sleep. Um, I'm learning about it, but there's a richness there that exists. Eighth principle um, is eighth and final principle is looking at the big picture in terms of governance and accountability, and to be able to protect the needs of communities. And so what we have is, it's often argued, not so much a healthcare system. A system is usually one that works well, like a filtration system, or I don't know. Um, we have a fragmented hodgepodge of band-aided elements that happen to work well some of the time, most of the time, but when they don't, it's problematic. So I think getting to back to the system is key. At least once while I'm doing these YouTube lectures, will my phone ring? Sorry about that. I'll let me finish this and then I'll answer the call. I'd like you to read all the elements of this article, please. And it is optimistic. It is almost like a vision of where the healthcare system should be. And like any vision, we might not get there in our lifetime. We might not get there at all, but we need to strive towards that. Now, I know I'm being very much glass half full or three-quarters full, but it is a key part to understanding all the elements of our healthcare system. So I'm going to just stop this go and to the Blackboard site. Where is the Blackboard site? There it is. Hold on one second, folks. So on the Blackboard site, I'd like you to, right below this, watch the TED Talk. This is an added part that I'd like to introduce you to this course. And it's not necessarily related to healthcare, but I hope you'll find this beneficial. If you haven't heard the term smart brevity, uh, want to introduce it to you through this TED Talk from the CEO of Axios, who, along with Politico, developed this wonderful program, theme, foundation about how to make things clear, short, or communications clear, short, concise. It's wonderful. There will be in the assignments, there is in the assignments tab, a small short brevity assignment that I'll explain and is due by, by the due date. But I'm going to invite all of you to use the themes of smart brevity throughout this entire course. Every assignment you turn in, including your final project that you'll do in teams, will be done in a smart brevity format. And so we're going to test this out here. But of course, this is not just about MHA 621. Excuse me. I think it's something that for you professionally, maybe personally, but professionally, could be something that you try out at your place of employment or in communications that you have. Maybe not all the time, but it is very effective. I have begun using this professionally here in my role at the university, and I'm introducing it to you to consider doing the same. Okay. All right, folks, I'm going to let you go. Thank you very much, and let me know if you have any questions. Bye.